Hi everyone, Dr. Quinn here again with Core Regenerative Medicine. Today we are going to discuss questions you should be asking your regenerative medicine provider but probably aren't. So the first question you should be asking is, what type of regenerative medicine procedures do you offer? And if it includes stem cells, what types of stem cells do they use? If they only give you one option for either one of those questions, you should run. In my opinion, that means that they don't know enough about regenerative medicine to have multiple options for you. And it also indicates to me that they probably don't have the ability to extract your own cells. I personally believe it's very important that they at least have learned how to take your bone marrow or your fat, which is where we most often get stem cells from, and inject that back into you. There are other options that can be purchased, like umbilical cells or exosomes or amniotic cells, and those are very controversial. It doesn't mean that they don't have a place, but I just think if someone only offers you those options, they're probably not that well trained in regenerative medicine. Another question you should ask is if they do ultrasound guided injections or fluoroscopically guided injections. There is no place anymore in the regenerative medicine orthopedic field to be doing injections without some sort of guidance. Another question that that you can be asking is where the physician learned, how long they've been doing it. Not that you're going to know, the difference between whether they learned at the American Academy of Orthopedic Medicine or the Interventional Orthopedic Foundation, but you just kind of want to get a sense that they've gone to a few different organizations or done a few different trainings and not just took one weekend course and called it good. Asking for references is always a good thing, though as physicians we can't give out names of our patients and their phone numbers. Every now and then a patient will allow us to call them about these procedures or give another patient their phone number. So there can be a workaround. I wouldn't hang my hat on this, but I think it's a good thing to call just to make sure that they have a few in their bucket that they're willing to call. Ask your physician how they keep up with new information, just to make sure that they're going to regular meetings, because the regenerative medicine world is very quickly changing and it's very important to stay on top of it. I would ask what their stem cell treatment entails. This is important when you're getting numbers, and if you're number shopping specifically, you really want to know what you're paying for, because sometimes they'll add things on during the procedure, and it's not that I don't think they're trying to be shady, it's just if you want to just price compare, you really need to compare apples to apples, because so many people have stem cell programs or just a one-time shot or stem cells with platelets, and there's just a ton of different ways to do it. And finally, and really most importantly, your physician should be able to really explain why you're a good candidate for stem cells or PRP or prolotherapy, and compare it to just doing a steroid injection or a hyaluronic acid injection or surgery, because you don't want to go to someone who's just trying to sell you on the only procedure that they know how to do and that they really think is good. You really want to make sure you're going to get the best care out there. And so, if surgery is actually what you need, they should be able to refer you to a good surgeon. If a steroid injection is really what you need for whatever reason, they should be able to give you that option as well. So please don't hesitate to call us if you have any questions. You can reach Core at 720-605-9355. And thank you for listening today.